Call the meeting of the Board of Health of May 1st to order. The first item on the agenda under new business are the minutes of the April 3rd meeting of the Lowell Board of Health. Do we have a motion to accept the minutes as sent?
Motion to accept.
Second?
Yeah, Allison.
Okay. All in favor, say aye.
Aye.
Those opposed? Motion passes. The next item on the agenda is the monthly services, development services report submitted by Senior Sanitary Code Inspector Jimmy Lee. Hello.
Good evening, board. How's it going?
Okay.
All right, so we've been doing a lot with the schools, but I mean that's what it's going to take in order to get the ball going here. So as of right now, we only have a few things. So freshman academy, the bathroom temperature that has been fixed. The issue with the pest control there is that pest control, if they come outside the hours of the regular kitchen staff, they don't have access to the back storage room because the custodian does not have that key. So I've been working with Paul in order to get the custodian access to everything because it just doesn't make sense that they don't have access, you know? So small stuff like that is kind of what we're finding out to be like the problem on the ground. Other issues when it comes to pest control is that the boxes itself, they need to be dated when you put down the box. They're not being dated. So there's no way for us to know if that bait station has been serviced or anything like that. We've come across ones in the high school here where they're dirty, either water's gotten on them, they're stained, and you come back and it's the same exact one, you know?
So whose job is it to put the date on the box?
It's a Banner's job.
So is he aware now? He knows he needs to be doing this? Have you guys talked to him?
I've sent him emails. DPW has talked to him.
I'm sorry, is your microphone on? I can't tell.
Yeah, they're all dogs.
Okay.
Oh, okay.
Yeah.
Okay. Maybe it's me. Maybe you could just talk a little louder.
Sure.
Thanks. There's some fan going that's whatever.
So
I'm
he's
sorry,
aware,
go ahead.
He's aware what we're looking for as far as the boxes go.
He is aware. Okay.
We've been lucky enough to have some pest control professionals as health inspectors now, so it's pretty nice. Aside from that, we have Shaughnessy School. They have a drain. It's not really something in our purview, but it just doesn't make sense either. It's used to boil pasta and stuff like that. But when they go and drain it, the drain's about right here. So you got boiling hot water coming at you. And it falls down to a drain where you're just gonna splash your legs and stuff. They've tried to fix it. The problem with this particular thing, it has a lid, so when you pick up the lid, it bangs the pipe. It's a whole design flaw. So I think Airmark is going to be fixing that. They're going to put some kind of like rubber sleeve over it. But there's not a ton that like health inspectors would have to say over that. We're just kind of putting it in there because that's what the cafeteria staff is concerned about. Then we got the McAuliffe. So the ceiling tiles at the McAuliffe, they kind of used the wrong ceiling tiles. So they used an insulated tile. It's not your standard like dry tile. It's like insulation, and then it's got this thin plastic on it. So it's steamy in there, you know? So as soon as any moisture hits it, that whole piece of plastic just like falls down. So if you go in there, everything's like bubbling or peeling. Very strange. But they went and changed them all. Yeah. So they've been doing it for the last few days, going in the morning, going in the afternoon. We went there yesterday morning. There was still some kind of sagging. I'm told today by Paul that they have all been fixed. Yeah, so as far as the schools, that's pretty much, it's not too bad right now. A lot of the schools are getting new roofs anyway, so they're kind of putting off that ceiling tile thing. Like,
On Fitzy's and Cozina's, who failed in the last couple times. I mean, neither of these are crazy failure things, but do you know what they failed the last times that they failed? What that was for? Offhand?
I don't. I just put that they did. I do have a running list, so everything that fails, I just throw on this year's list. So I just do a search for the year, and then it comes up one other time. So
Right. So my only ask you is that I mean, I'm the one who asked for that. I'd be curious to know, for you to run and make sure it's not the same thing over and over again, right?
right.
So that's my concern is that these aren't the same things they keep doing over and over again.
Yeah. Something like a Serve Safe and Allergen Awareness certification. If they failed the last time, they would have had to have gotten it in order to pass again. You know, so if you look at this one, they failed it and then they passed again a couple months later. So usually it's not going to be the same.
The same thing. Not for these things, right?
Yeah,
but
yeah.
for the mice and other,
Sometimes it would,
you know.
be. Right.
Yeah.
Right. Oh, another thing we want to say about the schools. So, our department now has access to their ticketing systems called School Dude.
Oh,
So now Lloyd is putting in my violations onto School Dude in order for them to see the ticket item. And since this whole thing kind of blew up, we've all just kind of jumped in on it in order to just to make everybody aware all at the same time. So hopefully that's going to stop a lot of the confusion going forward.
do you think it's helpful, the meetings? Are you attending the joint meetings with the,
At this point, I've stopped only because it wasn't that helpful. Me emailing them I wasn't getting a response, so I'd go to the meeting to hand it to them in person. And you guys know how that ends up. But at this point, finally, I think we're good.
okay,
Because those meetings are like big picture type of stuff, school renovation and stuff like that. That my part is so small.
I see.
So I think the system we have in place now is probably a little more effective.
You think the communication is better than it was?
So far.
For the moment.
That sounded a little
I mean, this list is a lot less
Right.
yeah, major
bothersome.
things.
Yeah, a lot less bothersome.
Madam Chair, we did also start an internal communication, email communication. So when the health inspectors do an inspection in the schools and they do fail, we've started an email chain within a group that I'm included on, the DPW commissioner, Aramark, the DPW commissioner, DPD, assistant city manager, Sean Machado, the assistant city manager. So there's probably 7 people who are on it that are aware when there's a failed school as well. So we started communication so that they're quite
That's great.
in
Okay.
real time versus
Yeah.
waiting for the board.
Mhm.
Yeah.
Right.
That school dude package must be a large document.
Yeah, that's
It's actually in tonight's, the full list is in tonight's
Oh, really?
school committee package, if you'd like to read it.
Oh, okay.
You guys got any other questions about?
So I think the month before last, when I was here and you were not, I asked a question about, at the time, it looked like we were going more than 6 months in between inspections. And I wasn't sure if that was a staffing issue or if you think that for the most part, they're being done 6 months or not, every 6 months.
So there could be a few reasons. One, yes, we sort of had a staffing issue. We had someone sick for a prolonged amount of time, and trying to fill in for that, so your regular duties kind of. And then when a place, we can go to a place in 6 months, we're supposed to, and then if there's an issue there, something like getting your hood done. I know getting your hood done now is like a big pain in the butt because one of the big servicers just sold ASAP, the people who usually clean and service these systems. They were sold to Impact, and now that Impact has taken all these clients, like it's a complete mess. People are waiting months and months to hear back, and it's still not like this happened maybe like a year ago. And this still hasn't been like fixed. Things like that, we just work with the business. They keep us in the loop, and then we just come back when they get it done. We just have it done, so it'll look like that they're late a few months on their inspection.
I see.
Some has fallen through the cracks. We lost like a lot of the data. My sheets or my master list really wasn't backed up in that way, so I'm kind of just rebuilding that. I know some have slipped through, so yeah, we're working on getting it as tight as possible.
Great, okay. Any other questions on the report? Anything else you wanted to, that's it?
Nope.
Okay, thank you.
Thank you.
The next item on the agenda for review is the Pride Star report and notifications. John Kelly?
Good evening.
Hi.
Hi. So opiate report, that was first, right?
Yes.
All right. Really nothing really unique. March was a typical month. January, February, March, we had a decline, which we normally see in the winter. It's pretty stable, I guess. We had talked a couple times ago about there was a grant that we had worked on with the Tufts University School of Medicine, First Watch and us, that was granted. We did get the grant. So I think it's $200,000 over a year or two to help the machine learning. So we have someone in-house who reads all the patient care reports, and then we figure out what actually happened on the call. With Tufts and First Watch, we're going to try to see how we can get machines to learn that, so that way it can expand to other cities as well.
Any questions on the overdose report?
Yeah, I just have a quick question. I know you have to do some of this for other things besides the Board of Health, but I've been looking at days of the month. The female to male ratio has been 30 to 60 for 3 years. And I'm just wondering, do you really need to keep putting all that detail in this report? Or is somebody really making you do that? That's number one. And number two is, you now have daily data for 3 years. Like, has anybody actually looked at all this data aggregated over a period of time to see if there is any real trend that you can use that's useful to use?
So the first part, our report gets it. So we create this for 4 cities, and a lot of departments turn it in for grant support. So the Haverhill Police Department, as an example, there's one of this customized for Haverhill, and their funders for their Narcan, that's some of the points they require.
Got it.
And personally, I don't have to do the work, so we'll just have them.
Okay.
The second part, yeah, so that was that study we did with Tufts before, where we're trying to try to see if there's some surge alerts earlier, like what can we pick up in the information before that. Day to day, no, it's not really used for that. We have data back to 2011, so we have the database has 15,000 overdoses in it.
Right.
It's got 900,000 fields, but yeah, day to day, it doesn't do much.
That's doing good. Right. Is there any way, my only request would be, is there any way to put the month totals at the top? Can you do that as opposed to day of the week? Could you have the monthly total that's on the bottom here, put that at the top?
So the last 12 months part, you'd like at the top?
Yep.
Sure.
I mean, if I'm being brutally honest, that's the one, really the one that matters the most to me. The days of the week and the days of the month, and even the neighborhoods at this point look the same pretty much all the time.
Sure.
So that's the one thing that I like to see on a monthly basis.
Okay. So on to the EMS data report.
Yep.
So last time we talked about on 911 contract off. So I didn't want to change the actual report. So there's page 20, 21, and 22. There's a subsection where we talk about new information, but I didn't want to change the core report first. So if we want to go through the kind of the main, like the normal part first. Again, a pretty normal quarter, thankfully. We needed 0 mutual aid, which I thought was pretty good for us. On page 7 is the over 12 minutes, and I know that's something the board we highlight each time because those are really the risk calls for everybody. So when we try to break it out a little bit easier, I know the last couple of quarters I've turned it in, it's not exactly user friendly. So we kind of thought about how we could make it a little bit easier for everybody. So we had 5 times out of the 90 occurrences, it took us more than 12 minutes. The patient ended up going ALS to the hospital. So that's kind of one of the breakouts we tried to get. It was 1 chest pain, 1 diabetic, a low blood pressure, and 2 chest pains. And then we tried to break it out with, we got the 5 patients went ALS, 41 were transported BLS, 17 were transported BLS and went to the waiting room, and then 27 times those instances resulted in no transport. Again, trying to figure out how we can present the data to make it easier for all of us to kind of figure out what's there. And then over to the left is kind of how the calls came in. We tried to break it out by chief complaint.
What's the off-contract contract?
So
agreement?
we'll get into that. So that's the 5th 911 call and beyond.
Oh,
That's
right.
the
That's
concept
right.
on
Right.
page
Yep.
21
Yep.
we'll
Yep.
talk about. That's what I
Got it.
kind of done the 20, 21, 22 page and then came back to do the over 12 and I brought that over and I figured I'd just leave it for that.
Got it. Okay.
Clinically, Casey's paramedics did an outstanding job again as normal with intubations and IOs. My medics do a lot less, but they did a great job as well. Going through the report, the next page on page 10, we hired 15 part-time people, or mostly part-time. Some of them are full-time. We actually have a high school student. So she is in high school at Neshoba Tech. They gave her part of her job as an internship with us. She gets paid, but she's working 3 to 11s on our ambulances. So that's kind of a new avenue we're trying. It's kind of a good experience.
Where does this leave you from a staffing perspective? Are you fully staffed, still looking for people, still way below? Where are you at with this?
Yeah, we're still probably, we're better than we've been in the last 2 years.
Right.
We're still down. We would hire, if I could find 30 full-time EMTs, we would hire 30 full-time EMTs.
Wow.
Just like every, fire
Yep.
departments, police
Yep.
departments, everybody, I'm sure the hospitals, everybody's still looking as much as they can find.
Yep.
And the tech was kind of a new path that we're trying with them. We've tried to, work out and like, all right, what other avenues can we find some people? So I didn't have anything else to point out in the normal report.
Well, and thank you for doing this
Of course.
contract report, because again, it definitely makes things look the way we want to see it. So
Yep. So page 20 is trying to research the other part, right? The page 21 and 22, and try to figure out some data points. Page 20 really comes from Boston EMS. This is a report that they create. They do annual reports to the city, and I don't know if the board wants it, the city wants it, but it took about 20 minutes to do this section, so it's not a heavy lift if we want it. So we tried to break it out by, we've really never talked about total medicals by neighborhood. So it's got by total volume and then percentage, right? Maybe that's important, maybe it's not. The next section is how the calls came into our dispatch center or how they get processed through 911 and the total volumes and percentage. So 10% of the calls we get go out as respiratory problems, 9% are falls, and so on. The reason the overdoses is low, you thought that would have been higher, is because it'll either come in as an overdose, an unknown, or an unconscious. So it's divided up in those 3 fields. So it's, it's a little not granular.
Mm-hmm.
I think that's the word. Mm-hmm. And then over to the right is just the age of the transported patients. Again, not sure if the board really has it, but it was easy enough to do, and thought maybe it would be interesting to some members, and maybe not.
I'm just interested in comparing it to your overdose distribution. It's a little bit similar, not quite, but it's at least a little bit anyway.
And then we go to page 21. 21 and 22 kind of work in conjunction. So you can see that after the first line, every line has an A, B, C next to it. So on page 21, and then page 22 explains what A, B, C is down the line. So it's a definitions page. So the biggest thing we learned during this is there's 7.8 billion seconds in a quarter. So when we tried to figure out, we talked about concurrent 911 calls, okay? We really have to know when a call starts and when it ends. So the thought was we can plot out every call, every second it was tied up. Well, when we did out the math, we spent a couple days working on the report and whatnot. When we did out the math, I was like, oh no, that's not going to work. There's 7.8 billion seconds. And I was like, well, let's do it day by day. Well, there's 86,400 seconds in a day. So that wasn't going to work really. So we're we're working with a vendor to try to make a macro to do some stuff. So what that's showing you now, so if you look at A, right, that's either the fourth 911 call or less, or it took us less than 8 minutes to get there. And that's the difficulty we have. So if it was the fifth call in the city and we got there in 5 minutes, it gets lumped in because we only investigate every call that takes us more than 8 minutes to get there. And every investigation takes about 7 to 8 minutes. So if we have to investigate every single call, that's 7 times the 4,700 minutes that it took us less than 8. So that's what we're trying to figure out. How do we break those out as well?
Okay.
That makes sense?
Yep.
Okay. So there were, 5,237 calls that would be quote unquote on contract, right? Within that first 4 911 calls, 4,786 we were there within 8 minutes or 759 or less. So that's a percentage of 91.4% and an average response time of 4 minutes and 52 seconds.
But you're saying it could be a little skewed because you're throwing some in there.
Fifth and sixth and
We
seventh.
don't know.
Yeah, that's what we're trying to work out so we can get even better, but that's the 7.8 billion second thing I ran into.
Yep.
And then if you go down that to section F, there's that 268. So there were 286 instances. That was the fifth 911 call or more. And then it breaks it out to because Doc, you had last time about, do we need a fifth truck? Do we need a sixth truck? So this is where we're trying to go with it. So we broke out, there were 100 and, H, right? There were 103 times that it was the fifth 911 call and took us more than 8 minutes. And the average response time was 10 minutes and 52 seconds. And then you go down, it was the sixth time, there was 37, and it was 11, and so on. So that's kind of what it looks like. I'm open to ideas. We kind of thought about what the objective was, what the board wanted to kind of provide some oversight. We looked at a bunch of different cities to try to figure out what they had. So this is the beta version.
Right. So just remember, the point of this, from my perspective, is by contract you're supposed to be 90%, and we wanted to document that you're over 90%. So we accept this and just ask you to keep tweaking it to try and get it more accurate. But I'm okay with this for right now.
Okay. Should we leave it as pages 21, 22, 23, just to make it easier for now? Like, just keep doing the other report as it is?
Once a year would be enough for me on this one. That's up to the
Sorry?
I said once a year would be enough for me on this one, but it's up to everybody else and what they would want. But this one I would want every time. That's the actual estimated under 8 minutes for your contract.
Okay.
That one should be in there, from my perspective. I'll defer to that.
Well, how about for right now? We'll keep doing I'll just do this again every quarter.
Yeah.
And then maybe 6 months from now we can talk and figure, okay, what do we take out of the other one and put this in? But
Sure.
next
Okay.
time it'll just be the same as this.
Sure.
Okay.
Okay. We can do that. Yep.
Perfect.
Great.
Thank
Any other
you.
questions? Thank you very much.
All right, cool. Thank you so much.
Have a good night.
John, did you guys start giving out the, on the truck, the Suboxone on the truck at all, or?
No, so
Okay.
we're still doing through that internally.
Okay.
Um,
Did you want to talk a little bit about that, or are we too early?
So on April 1st, the state of Massachusetts authorized EMS to give Suboxone in the field. Buprenorphine, excuse me, not Suboxone. So we're kind of internally trying to draw up some policies for it. We'll get with Casey and Dr. Drake if we decide to go forward with it. We were working on a special, so we've talked to people around the country as well, and they all suggested to try to do Zofran with it. So that's a special project waiver for BLS. So New Hampshire actually has a protocol that you can, to help take nausea away, you can rip up an alcohol swab and have them smell it. So what we're actually trying to do now is that's going to be our special project waiver with the state would be to use that to help with the nausea that comes along with post-overdose care. So we're still, internally, we're still discussing it. And once we do, then we'll get with, Casey and Dr. Drake and make sure that everybody thinks, and then we can come to the board and propose it. So April 1st, Massachusetts changed the regs to allow it.
The other thing I forgot to ask you, and I'm going to get it wrong, but you guys proposed this new algorithm for
Oh, yes.
triaging, right? So any update on that?
Thank you. So we've kind of run into two little hurdles. It hasn't started yet, hopefully this fall. So when we sat down to do out the actual kind of rollout of it, I think the 911 Center has some technology hurdles which would really make it difficult for them to do it. Their EMD program is not tied with the CAD. So as a person is EMDing it, the information doesn't go any to the other people. So then it would become a hurdle for them to get it to us.
Right.
And then on top of that, the LPD had a command change in the 911 Center. And the new commander is just trying to get up to speed and you know, it's that captain's purview. And he just needed some time to get settled before he was ready to, you know, dive into that element of his job. So the city put in for a grant through the Mass 911 department. So hopefully they would have it this fall. So the technology element of it will be gone by then.
Got it. Okay. Yep. Great.
Thank you. I forgot.
Just let us know. Thank you. Appreciate it.
Thank you.
All right.
Thanks,
Thanks.
guys.
The next item on the agenda is a body art practitioner license, tattooing only for Ariel Diaz, 2 Colwell Ave. The establishment is Black Sheep, and the practitioner checklist was mailed, and it looks like everything is in order. Do we have a motion to approve the body art license for tattooing?
Sure. Go ahead. I'll make the motion.
Second.
Thank you. All those in favor?
Aye.
Motion approved. Vote yes.
Bill?
Yep.
Aaron? Allison?
The next item on the agenda is informational purposes. The Pan Am Railways has sent us their yearly operational plan around pesticide regulations and when they would be doing the herbicide application. Any questions?
Nope.
Next item on the agenda under old business is the director's report. Director Golden?
Yes, so the public health nurse manager made a few changes to her report to try to make it a little bit easier to read. I believe she went on a few other cities and found something that was a little more user-friendly and added a little bit of verbiage to some of the things to try to make it a little user-friendly. So if you had any questions.
No, I appreciate it. Thank you for doing that.
Looks good.
And then I think the school health unit one was a little easy to read as well.
I'm revoking the word revoked forever.
Okay.
Tobacco control, Caesar will be here next month.
Okay.
And then substance abuse had medication take-back day. There'll be a write-up next month, but they did have 92 cars drive through. And there was 221 pounds of sharps, which would be the equivalent of 24,310 sharps. I think maybe that could be people with using Ozempic and Wegovy, like people with those probably. And so I was thinking that maybe we should put some flyers at the weight loss clinic maybe for the next time for people who are trying to get rid of some sharps there. And it was 216 pounds of pills that were passed in. So that was pretty good because last time it was only, I think, 60 cars doing a drive-through. So they're planning one for the end of June. So we'll have that in next month's packet.
Did they do anything different in terms of advertising that they got?
No, we actually were a little late to the game to get some flyers out this time. We did do it in conjunction with the DEA Take Back Day, so we haven't usually done that. So it was on the DEA's page, so maybe that was why. But
Great.
and then just an update for the ICC for the migrants. So most of the floors are taken up except for the first and second floor. So I believe we're at about 550 people there. So 230 rooms are being used over there right now. We do have a vaccine clinic planned for May 17th. So the state will come in John Snow will come in and do vaccines for the school-age children, so I believe it's 17 and below. Anybody who signs up for the clinic, they'll do vaccines there for school-age children.
So
So that-
DPH is doing the vaccines?
It's DPH is having them come in to do it, and the health department will help with the staff to do the registration, but DPH is sponsoring it. So they're helping us arrange it, kind of like how Cataldo used to do
Yeah.
the clinics. So it's like a mobile vaccine clinic. Yeah.
Okay.
How long do they stay at the ICC? Is it indefinite or is there a short?
So there's a 1-year contract with an extension for a second year. And that started, I believe, around January 1st, but I'm not actually sure of the date.
But it doesn't mean so that's the contract that UMass has with the.
Right.
Right.
But
What about
that-
people?
But people themselves don't.
So some of the people have actually moved in and already left
I'm just asking you, is there a maximum time at which they are thrown? I don't use the word thrown out, but
for one family. No, there's not like a, I
No,
don't,
Like
I
no-
with
don't,
the homeless shelters, they're proposing it be 6 or 9 months.
yeah, I'm not sure. Yeah. Yeah. But some people have actually already found housing and moved out or gone to different parts of the state or something. So, yeah.
Madam Chair, I do have to, I think we should recognize Dr. Conley
Oh, yes.
for providing years of service to this board. I'm not sure that Aaron Nelson ever actually had a chance of meeting him, but he was the physician advisor for years, and we should recognize him and, I don't know, a moment of silence or anything, but, thank you for all his hard work. And do you have a replacement yet?
Not yet. We have 2 people who are interested that are discussing the contract with the law department, so we don't have anything yet.
What do you mean? Did you get offer both of them?
No, we haven't offered them anything, but they have
Shown interest?
There's 2 that shown interest, yeah.
they've shown
Yeah.
interest. One of them just had different questions. That's all.
Different
Yeah.
what?
They have different questions.
Totally different, quite right.
Yeah, like different questions related to different things. That's all. Yep. So
I will, yeah. Do we interview them, or do they just give the job? Do you interview them? Who does the decision making? Is that you?
there's like a process. Yeah. So yeah.
We have to sign the board has to sign the contract, right?
Yes, the board. The contract will go back and forth with law, and then the board. I'll have them come and meet the board, and then the board will sign the contract. Yeah, absolutely. Yep.
I mean, for the record, I know them both.
Yes,
I think they're both excellent. I
Yep.
think either one of them would do an excellent
Correct.
job and be
Yep.
maybe a little more motivated or involved than our.
Yes, I agree with you completely, 100%. Yep.
Great.
Yep.
That's great news.
That's all I had.
Do we have a motion to adjourn? Motion to adjourn seconded. All those in favor?
Oh, wait.